All right, we're gonna move on now to lower extremities. Again, you can do upper and lower together. We're just separating out for your sheets here. Okay, so again, we're gonna look at the skin. Typically, you want your patient in a gown or shorts. She forgot, it's fine. So we're looking at the skin and looking again for any discoloration, swelling, masses, looking at symmetry in the lower extremities and any muscle fasciculation there. So we verbally report skin color is consistent with ethnicity. There's no discoloration or swelling noted, and lower extremities are symmetrical. And then we want to look at hair distribution on the lower extremities, because peripheral extremity hair loss can occur with peripheral vascular disease. And so, of course, a lot with females, you're not going to have the hair on the lower extremities, and she doesn't, she shaves. And you're also looking for hair on the toes as well, because again, that's peripheral vascular disease, that loss of hair there. And she's not a very hairy person, I guess. She doesn't have that hair there. And so you would say hair distribution is present to lower extremities bilaterally. There's no evidence of abnormal hair loss, or you can just say no hair noted to lower extremities as patient shaves her legs. So either or is fine. You're also looking for varicosities, so you're gonna have the patient stand up, and then while she's standing here, you're gonna be looking, move this back. While she's standing, go ahead and stand up here. You're gonna be looking at the lower extremities, because it's when they're standing in that gravity pulls that you can see those varicosities that will pop in the legs. And so we're not seeing any varicosities there. And then, let's see, we are going to be able to say no varicose veins present in lower extremities bilaterally, or if they do, then you describe which leg it's in, right or left or both. So go ahead and sit down again. And then we're going to palpate for edema. And so with this, we're gonna just feel the lower extremities for any edema they may have, especially along that, the tibia there. You're gonna press in and hold and release and see if there's any type of indentation in there. And so you're gonna describe the edema if it's present, if it's pitting or non-pitting. And we can also palpate the popliteal space to see if there's any bulging or tenderness or swelling there, looking for a Baker's cyst. And then we also wanna palpate the tibiofemoral joint space with a patella, suprapatellar pouch, and infrapatellar fat pad. So we're gonna palpate all along in the knee joint there as well, and look for any swelling or pain or discomfort as well. And then we are going to palpate the ankles and toes. We're looking for heat, redness, swelling, tenderness, and palpate that Achilles tendon, the anterior ankle, and the medial and lateral malleoli. So while we're, got this up here, so you are gonna palpate all along the ankles, on the feet and the toes, and at this point too, I could even check that capillary refill so that I know it's present and equal bilaterally, and any pain or tenderness. Good. So I would say no edema, heat, or tenderness to the lower extremities bilaterally. And then we're gonna feel for that popliteal pulse. And so with this one, you can have them lay on their abdomen. When attempting to palpate this one, it's kind of a more difficult one to palpate. So while they're sitting here, relax. You can push up behind that space, and see if you can feel it, or you can have them lay on their belly. Turn around. Nope, or that. That's fine, I guess. And you would have them kind of bend their knee up and relax. Oh, there it is. It's definitely the easier way to do it. And there it is. So popliteal pulse +2 and equal bilaterally is what you would verbally report. And then we'll go ahead and flip back around. And then we want to palpate the pedal pulse, dorsalis pedal pulse. And so that's between the first and second toe, just before that bony protrusion. And so with that, you're going, so right between that first and second, and there it is. And and you can feel those equally bilaterally. So +2 and equal bilaterally. Posterior tibial pulse, that one's between the heel and the medial malleolus. Good. And +2 and equal bilaterally to the posterior tibial pulse. And I already checked the cap refill, which is less than 2 seconds bilaterally. So then what we're going to do is do the superficial tactile cotton and pain, sharp, and dull test. Again, like I said, it would probably be easier to do these all together at once, but we're going to do this to your lower extremities, Maddie, and with your eyes open. This is soft, this is sharp, and then this is dull. Okay, can you scoot back just a little bit? So now with your eyes closed, it's going to be hard to do that up here with the skin, or with the skin being covered, but with your eyes closed, tell me if you feel sharp, dull, or soft.
Soft. Sharp. Dull. Sharp. Soft.
Good. Very good. So again, you don't have to go extreme and do like every single little point. You want to make sure to get some sensation in the feet, and then make sure they have sensation to their lower extremities as well. Okay, and then what you would report is superficial, tactile, and sharp and dull pain sensation is intact and equal. Bilaterally, patient is able to verbalize sensations felt. Now we're going to look at our plantar reflex and then our other deep tendon reflexes here. So with the plantar reflex, we're going to stroke the lateral side of the foot from the heel to the ball. And we want to see flexion of the toes, all right? That's normal. Babinski is that dorsal flexion of the great toe with or without fanning of the other toes. And that Babinski sign indicates a pyramidal tract or corticospinal and bulbar tract upper motor neuron disorders. Say that one 10 times fast. And that's in anyone older than 2. So the Babinski can be normal in someone 2 and younger, but if they are over the age of 2 and you see that dorsiflexion of the great toe, that is an abnormal sign. So with this one, we're going to have the foot here, and we're going to stroke it with a pin or the bottom of a reflex hammer from the heel up to the ball of the foot. And you can see your toes kind of move there.
My toes are weird.
Let's see here. Well, relax.
Okay.
So she has some movement and it's outward. It's not inward. And so we'll do both sides. Yeah, she doesn't have the best plantar reflex, but it is intact, but I'd probably say it's more of a +1.
Don't have any arch.
You don't have an arch. That is very true. So then we'll do the knee and Achilles one as well. So we're gonna, with this one, have you scoot to the edge. Make sure that the bed is up high enough that their feet aren't touching the ground, and so that they can't have any pressure on there. So there's a couple things you can have them do. You can have them just see if they relax enough to allow you to do this. If they're tensing up and not allowing for the reflex to happen, you can have them squeeze their hands and push it together and focus on that, and it takes the focus off of what you're doing here. So I'd stand over to this side. You're gonna feel right in that anterior patella there. Scoot this side a little bit. Okay, relax.
I'm trying to. It's hard for me to relax. I did this one.
Okay.
How does that happen?
I mean, she's getting movement. So I would still say a +2. This one is a little on the hyperactive side, maybe even a +3. That's okay. And then we're gonna do the Achilles one. So this one you're gonna have flex the knee to the 90 degrees, just like she's doing. And we're gonna keep that ankle in a neutral position, and we're gonna hold the foot in our hands. We wanna strike the Achilles tendon at the level of the ankle malleoli. And then we're gonna have a contraction of the gastrocnemius muscle, which causes the plantar flexion of the foot. So with that, I'm going to put the bed up a little bit higher so you can see what I'm doing a little bit better. And yeah, don't jump off the bed. Okay, so with this foot is one I can see in there best. Again, relax, okay? This is all on me. So the knee's at 90 degrees. I'm holding the foot in a neutral position, level of the malleolus, the blunt side of the reflex hammer, and you can just feel a light flexion there of the foot. So again, relax, and a light flexion there.
How is this one so?
That one is a little bit hyper. So then again, you just report +2 and equal deep tendon reflexes to the patella and Achilles. Now we're going to look at muscle strength. So we want to look at quadriceps and hamstrings. We're going to extend the lower extremity with resistance to test the quads and flex the lower extremities with resistance for the hamstrings. And we're going to look at foot dorsiflexion and plantar flexion. So go ahead and don't let me pull. Don't let me pull. There we go. Yep, that's hamstrings. And then push against me. There's your quadriceps. And then we're going to have push down. That's plantar flexion. And then push up. And that is dorsiflexion. And so I'd say muscle strength is +5 and equal bilaterally to the hamstrings, quads, and ankles. Okay, so now we're going to look at range of motion. So this is one you get to get down, to get fun, and get some movement on. All right.
That's so loud now.
So go ahead, and I'm going to have you stand over there. And we're going to, well, there's your spinal movement right there. All right, so with this, we want to do the range of motion. So you can do this standing or laying down. So with one test that you can do is have them do the duck walk. So you can get down.
All the way?
Yeah, all the way squat down. Move your arms and walk. So right there, you're seeing the flexion and range of motion of the hips, the knees, the ankles. All of that is in that one movement there. So if your patient can do duck walk, like if you're doing a physical exam on a kid, perfect. But not everyone can do that, right?
So my legs sore tomorrow.
So with the hip, we want to have you swing your leg backward for hyperextension. Good, making sure you're in the video. Good, and do it the other leg. Good, and then raise legs forward for flexion, and other leg. Good, and then we want to raise your knee to the chest, and do the same thing with the other one. We have some more hip flexion, and you're also getting the knee test in there as well. And then we want to have you swing your leg out and in. So we have our adduction is inward, adding it to the body is how I remember that. And your abduction is outward. Do the same thing on the other side. Adduction, abduction. Intact and equal bilaterally. And again, you can do this while they're laying on the bed as well. So we know that she has full range of motion to her hips. Now when we're looking at knees, you can, again, we assess some of her knee movements and those previous movements with the hips. So we can do it again, those separately. So we'd have bend each knee, so that would be flexion. Good. And then straighten the leg and stretch it, and that's full extension. Good. And same thing, full extension. Great. So full range of motion to knees bilaterally. Ankle, again, we already did plantar and dorsiflexion, but we can also have her move her foot inward for inversion and outward for eversion. Same thing on the other side. Inversion, eversion. And you can rotate the foot inward for adduction. Rotate the foot outward for abduction. Same thing on the other side.
It won't fall.
So you have inward rotation for adduction, outward rotation for abduction. Very good. And then with the toes, you just want to bend and straighten the toes for flexion and extension on both sides. Perfect. So summary statement, after you have them do all those range of motions, you can just say full range of motions to hips, knees, ankles, toes bilaterally without crepitus pain or limitations. Very good. That is the musculoskeletal lower extremity exam.